How you doing, sir? My name is John Robinson. I'm the ambulance company. Your roommate called. He said he heard a large thump and came out here, so we're just here to check you out. First off, what's your full name? Brogan. Brogan. That's an interesting name. Okay, Brogan. What happened? Okay, so you just got back from Hawaii. How long were you out there? 4 days. 4 days in Hawaii. That's a pretty nice trip. You're out there for what, an anniversary? Okay, great. Did you feel any? How did you feel when you were out there on a plane or anything like that? Okay, you felt a little sick, a little weak, a little weaker than usual. Okay. What about today? Same thing. Okay, patient's been feeling weaker the last couple days. So today, what happened? You were just walking to getting ready for class. You just fell. Okay. When you fell, did you hit your head or anything like that? Did you injure yourself or anything like that? You mind if I just check your head? Okay, check the patient's skull. He said he did fall. Want to check, make sure he doesn't have any other trauma. You're not in any pain or anything from your fall, right? You didn't hit your head, no arm or anything like that, any abrasions, cuts, nothing? Okay. All right. So what's your medical history? Okay, no medical history. Do you smoke cigarettes? Do you any drinking or anything? Excessive drinking lately? Nothing. Okay. What about your any nausea, vomiting, or anything like that? No vomiting. What about diarrhea? Okay. So it's been a little black, a little tarry. Okay, sounds like a GI bleed. Okay. My partner's just gonna get some vitals on you real quick. Okay. How do you feel right now? Do you feel like you need to vomit or anything like that? How's your stomach feel? Is it just weak? Okay. All right. What do we get in those vitals? Okay. So we got 88/68 on the BP. Heart rate is elevated at 102. SpO2 is 98%. So you're getting good room air, which is good. Your blood pressure is just a little low. Is probably why you did have a syncopal episode due to your blood pressure and your preload. You're having some preload issues. So I think we should bring you to the hospital, get checked out. They'll run some tests, run some exams. So for my patient, sounds like he's having a GI bleed. He had a syncopal episode, negative trauma, negative history, allergies, medications, no nausea, no vomiting. We're going to take my patient code 3, not to UCI where his dad works, but to maybe West Anaheim, which is a much crappier hospital. It's probably where he went, and his dad brought him. But en route, we will give IV, give the patient some fluids. Sounds like he has a volume issue, is why his blood pressure is very low, and had that syncopal episode. Patient's SpO2 is 98. He's not having any breathing problems, no shortness of breath. It sounds like a volume issue right now. Patient needs some normal saline and needs to check to see some additional tests at the hospital to see what's going on in his stomach.